Gynecologists have read it. What's the most horrifying thing you've ever seen? These stories will stay with you. A gynecologist's most shocking case. I'm a gynecologist, and over the years, I've seen some truly disturbing cases. Sometimes young women come in after wearing the same tampon for days, or even weeks. The damage that can cause is already horrifying enough, but none of those cases came anywhere close to the worst one I've ever seen. One day, a 19-year-old woman came into our clinic and quietly admitted that she had a hairspray can cap stuck inside her vagina. At first, I thought, okay, that's unusual, but it shouldn't be too difficult to remove. Then she told me the rest. She had inserted it when she was 15 years old. It had been there for 4 years. She never explained why she did it. She was clearly overwhelmed with embarrassment and could barely look anyone in the eye. Even before the examination began, there was an overwhelming smell of severe infection. Once I started examining her, it became dramatically worse. The cap had been inserted with the open end facing upward, and after 4 years, her vaginal tissue had actually grown around it, almost trapping it inside her body. As if that weren't bad enough, the cap had eventually pierced both her bladder and her rectum, causing catastrophic internal damage. Removing it wasn't a simple procedure. It required multiple major surgeries to safely extract the object and repair the extensive injuries it had caused. I'm not a gynecologist, but this story still haunts me. I'm not a gynecologist, but I know someone who recently had a hysterectomy, a surgery to remove the uterus. After the operation, she had internal stitches that needed several weeks to heal completely. Her doctors made it very clear that she needed to avoid sex until everything had healed, but she couldn't wait. She ignored the medical advice and resumed her sex life far too soon. The result was catastrophic. The surgical incision reopened, and part of her small intestine actually protruded through her vagina. The person who told me this described the entire incident in such vivid detail that I honestly don't think I'll ever look at ground meat the same way again. According to the woman herself, while she was being rushed to the hospital for emergency surgery, she could actually feel her intestine resting against her leg, and she said she could feel it pulsing. Some stories stay with you forever. This is definitely one of them. I'm not a gynecologist, but these stories are unforgettable. I'm not a gynecologist, but I know someone who recently had a hysterectomy, a surgery to remove the uterus. After the operation, she had internal stitches that needed several weeks to heal completely. Her doctors repeatedly warned her not to have sex until she had fully recovered, but she couldn't wait. She gave in to temptation and resumed her sex life far too soon. The consequences were devastating. The surgical incision reopened, and part of her small intestine actually protruded through her vagina. The person who told me the story described every detail so vividly that I'm pretty sure I'll never look at ground beef the same way again. According to the woman herself, while she was being rushed to the hospital for emergency surgery, she could actually feel her intestine resting against her leg, and she said she could feel it pulsing. Some stories never leave your mind. That is definitely one of them. I also had a friend back in high school who was absolutely terrified of going to the gynecologist. She avoided her first pelvic exam for as long as she possibly could. When she finally worked up the courage to go, she was so nervous that, the moment the examination began, she instinctively clamped her legs shut around the doctor. She later said it took her a while to calm down enough to relax and let the doctor continue the exam. It was incredibly awkward for everyone involved. These days she can laugh about it, but she's still extremely uncomfortable when it comes to gynecological care. In fact, she still doesn't even like using tampons. I was a medical student when this happened. At the time, I was a medical student, and I volunteered to assist during what we were told would be a fairly routine hysterectomy. Before the surgery, we were informed that the patient had a small ovarian cancer. It sounded like a difficult case, but nothing out of the ordinary. Then we opened her abdomen. What we found was far worse than anyone had expected. The cancer had spread almost everywhere. Her abdominal cavity was filled with metastatic tumors, and instead of a straightforward operation, we spent hour after hour removing as much of the cancer as we possibly could. The surgery that was supposed to last about 3 hours stretched into 13. At several points, surgeons from both the general surgery and vascular surgery teams had to join us because the procedure had become so complex. During the operation, she lost an enormous amount of blood. In the end, we had to replace roughly half of her total blood volume just to keep her alive. The recovery was incredibly difficult. She spent a long time in the hospital, and there were moments when none of us were sure how things would turn out. But somehow, she pulled through. Eventually, she recovered well enough to go home and be reunited with her family. It was one of the most physically and emotionally exhausting cases any of us had ever experienced. But the patient and her entire family were some of the kindest, most grateful people I've ever met. Helping them wasn't just our job, it was an honor. I'm not a gynecologist, but I occasionally perform exams. I'm not a gynecologist, but I do perform gynecological examinations from time to time. One case has stayed with me ever since. A young woman came in complaining of a terrible odor and discomfort. During the examination, I discovered a tampon that had been retained for at least a month. What shocked me even more was what she told us next. She had been sexually active the entire time, without realizing the tampon was still there. The smell was almost unbearable. Even after removing it, the odor lingered throughout the exam room. When she finally left, we had to leave the room open and air it out for hours. The entire staff spent that time wandering around the clinic, trying very hard not to throw up. I've seen plenty of unpleasant things in medicine, but that smell is something I'll never forget. My dad once told me about a case he'd never forget. My dad once told me about a woman who had a severe heroin addiction. For reasons no one could understand, she decided to inject herself somewhere completely different one day. Instead of using a vein, she injected heroin directly into her labia. It turned out to be a catastrophic decision. The injection led to a severe infection that progressed into gangrene, destroying the surrounding tissue. She ultimately required emergency medical treatment to prevent the damage from spreading even further. I don't know what she was thinking, but if there was ever a situation where the risk wasn't worth it, this was definitely one of them. I was expecting the worst, but I was completely wrong. I'm a medical student. Well, almost not anymore. In just a few weeks, I'll officially be a doctor, not a gynecologist, but during one of my clinical rotations in gynecology, I was assigned to examine a patient. As I was getting ready for the exam, I noticed an absolutely overwhelming smell filling the room. My first thought was, this has to be the worst case of bacterial vaginosis I've ever encountered. I braced myself and began the examination. I looked carefully, but nothing seemed unusual. There were no abnormal secretions, no obvious signs of a severe infection. It didn't make any sense. Then I leaned back for a better look, and that's when I noticed something strange. The farther away I moved from the examination table, the stronger the smell became. After a very confusing moment, I finally realized what was going on. The smell wasn't coming from the examination at all. It was coming from her feet. She simply had the smelliest feet I've ever encountered. After all the dread and anticipation, that turned out to be the real diagnosis. One of the wildest medical stories I've ever read. If you're interested in strange medical stories, I highly recommend reading Dr. Lisa Rankin's book, What's Up Down There. In one chapter, she shares some of the most unbelievable cases from her career. She writes about finding everything from insect larvae to money and all kinds of unexpected objects. But those stories were nothing compared to one case in particular. A woman came in because something was literally growing out of her vagina. Wait, what? According to the story, she had used a potato as a form of birth control and left it inside. As bizarre as it sounds, potatoes thrive in warm, dark, and moist environments. Over time, the potato began to sprout. Eventually, green potato shoots were actually protruding from her vagina. It's one of those stories that sounds completely unbelievable, until you realize it came from a physician recounting one of the strangest cases she'd ever encountered. This story isn't about a vagina, it's about a breast. This isn't a gynecology story, but it's every bit as disturbing. Back in high school, I joined a student program that let teenagers shadow medical staff in a local emergency department. I thought it would be a great learning experience. One day, a severely obese woman came in complaining of breast pain. The moment she entered the room, everyone noticed an overwhelming odor. The doctor decided the area needed to be cleaned before he could properly examine her. As he gently washed the skin and lifted one of her breasts, the smell became almost unbearable. Several people in the room had to fight the urge to gag. Hidden beneath the breast was a thick layer of dead, discolored skin. The doctor carefully cleaned the area, and as the crust loosened and came away, it exposed a small opening underneath. Then something moved. Tiny cockroaches began crawling out. The doctor believed insects had likely laid eggs deep within the warm, moist skin fold. When they hatched, the insects had become trapped beneath the damaged tissue. With nowhere else to go, they eventually forced their way out through the small opening. I've seen and heard a lot of disturbing medical stories since then, but that's one image I'll never be able to erase from my mind. The most disturbing hospital story I've ever heard. My mom worked in healthcare, and out of all the hospital stories she's ever told me, this one has always been the hardest to forget. One day, a woman in her 50s came to the hospital. She weighed over 600 pounds. She told the staff that her husband had noticed a terrible smell during sex and insisted something was seriously wrong. The unsettling part? It wasn't just her husband who noticed it. The smell was so overwhelming that everyone in the department could detect it. After examining her, the medical team discovered the cause. Large areas of vaginal tissue had become necrotic. The tissue had died due to severe disease and infection. She required emergency surgery in an attempt to remove the damaged tissue and control the infection. But by then, it was already too late. Despite every effort, she passed away not long afterward. The detail that has always stuck with me is how the problem was first discovered. Her husband was the first person to notice the horrific smell, and he noticed it during sex. Of all the medical stories I've ever heard, that's the one I've never been able to forget. I'm not a gynecologist, but I've seen some truly devastating cases. I'm not a gynecologist, but during my medical training, I witnessed more than a few cases that have stayed with me forever. The first involved a woman with advanced vaginal cancer. Later, I saw her again after surgeons had removed both her vagina and cervix in an attempt to save her life. I was still a young medical student, so I don't remember every detail of the procedure. What I do remember is the emotional weight of that moment. The surgery had been incredibly extensive, and seeing the aftermath was heartbreaking. But what affected me most wasn't the operation itself. It was what happened afterward. She looked at her husband through tears and begged him to leave her. She told him, "After this, you'll never be able to love me again." He never even considered it. He stayed by her bedside every single day, holding her hand, comforting her, and reminding her that he loved her. You could tell he absolutely adored her. To this day, that's one of the most powerful displays of unconditional love I've ever witnessed. The second case was even more tragic. A woman weighing nearly 220 kilograms was admitted after becoming paralyzed from the waist down. She had developed a massive wound complicated by necrotizing fasciitis, a rapidly spreading infection that destroys soft tissue. The infection had devastated the entire area around her pelvis and buttocks. There was almost nothing left of the normal anatomy. The rectum had been severely damaged, and stool was leaking through multiple openings in the wound. At one point, we were asked to collect a urine sample. That's when we realized there was no functional bladder left. There was no vagina left either. The surgical team decided to do everything they could to manage the wound, even though everyone understood how desperate the situation had become. It took 6 of us just to carefully roll her onto her side. Then we began packing the enormous wound with sterile gauze, hoping to control the damage as best we could. Despite everyone's efforts, she passed away not long afterward. Sometimes medicine can perform miracles, and sometimes, despite doing everything humanly possible, there is simply nothing left that can be done. The story that has stayed with me the longest, though, isn't the second one. It's the first. I still hope that woman found peace, and that she had many more years with the husband who never left her side. I'm not a gynecologist, but I found out I was born with a rare condition. I'm not a gynecologist, but I was born with a congenital condition that I didn't discover until I started using tampons. I had what's called a vaginal septum, a thin wall of tissue that divided my vagina into 2 separate canals. The problem was that I had no idea it was there. Everything seemed completely normal growing up. I only realized something was wrong the first time I tried using a tampon. I inserted it without any problems, but when it was time to remove it, I couldn't find it. I kept trying to pull it out, but it wouldn't budge. What I didn't realize was that I had inserted the tampon into one canal and was desperately trying to remove it through the other, much smaller opening. The pain became unbearable. No matter what I tried, I couldn't get it out. Luckily, my mom was home. At first, she assumed I just didn't know how to remove a tampon, but after taking a closer look, she immediately realized something wasn't right. She took me straight to a gynecologist. The doctors diagnosed the congenital septum and performed surgery to remove it. After that, everything was completely normal. I've never had another problem since. I'm not a gynecologist, but I didn't realize I had a birth defect until I tried using a tampon. I'm not a gynecologist, but I was born with a condition that went completely unnoticed until I started using tampons. I had a vaginal septum, a congenital band of tissue that divided my vagina into 2 separate canals. Growing up, I had no idea anything was unusual. Everything seemed perfectly normal. I only discovered the problem one day when I tried to remove a tampon. I had inserted it without any trouble, but when it was time to take it out, I couldn't find it. I kept reaching for the string, but it just wasn't there. The reason was something I couldn't possibly have known. I had inserted the tampon into one canal and was trying to remove it through the other, much smaller opening. The tampon wasn't actually stuck. I was simply looking in the wrong place. I was in excruciating pain and had no idea what was happening. Thankfully, my mom was home. At first, she thought I just didn't know how to remove a tampon, but after taking a closer look, she immediately realized something wasn't right. She took me straight to a gynecologist. The doctors diagnosed the congenital septum and performed surgery to remove it. Since then, I've never had another problem. Sometimes you can live with a congenital condition for years and not discover it until one completely unexpected moment changes everything. After reading all of your stories, I don't think I'll ever feel embarrassed again about forgetting to shave my legs or my bikini line before a gynecologist appointment. Compared to everything doctors deal with on a daily basis, a little body hair is probably the least interesting thing they'll see all week. Honestly, I think I've finally gained a little perspective. Thank you so much for watching all the way to the end. If you enjoyed this story, don't forget to like the video, subscribe to the channel, and turn on notifications so you don't miss the next episode. If you have any thoughts about what happened, let us know in the comments below. We'd love to hear what you think. Thanks again for watching, and we'll see you in the next story.